Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, Lima Dental Associates. So what does that mean? That means Dr. Wesley Shankland is here with us. What do you want to talk about today?
Good morning, George. I'm going to talk about something that's unusual and could be controversial, may not be controversial, facial and oral piercing.
Oh, boy.
Now, we all see that, at our age, a few of us have tattoos or piercings and things. And I know you being an old Coast Guarder, you old Swabbies, a lot of those guys back then were the only tattoos you'd see.
That was true.
That's true. Well, today we see kids, and that's their generational thing. No comment about that, just the way they are. Mm-hmm. But some of the things, back years ago, our American Indians in this area had facial piercings, had tattoos. Egyptians, thousands of years ago, had these things. And a lot of times they wear a little piercing through their lip or parts of their body that would indicate royalty. And the Indians, I know, would wear things that have specific meanings in their tribes, and you could pick tribes out by their piercings. So this is not new with the young people.
I have a question for you.
Yeah.
How does piercing trend affect dentistry?
Well, that's an interesting question. Now, the oral cavity is the dirtiest cavity in the body. And when somebody puts a piercing through the lip or the tongue or the cheek or somewhere, you can cause an infection because the tissue could be infected. There's a chronic inflammation all the time. You see it red around there. It can cause loss of taste if they pierce the tongue and hit a nerve called the chordotympany nerve. It can damage taste to the anterior two-thirds of the tongue. It can cause teeth to be cracked because these things move around and hit the teeth. They can cause a chronic inflammation, and just a real problem like that if they're not kept clean and they're not handled properly. Now, we tell people when they come in our office, for one thing you can do for the dentist or the hygienist, and I'm not against this piercing, that's not a comment on that.
Right.
The issue is, please take those piercings out before you come to see us, because they get in our way of our instruments, of what we're doing. They can cause problems, and just take them out. And people should take them out maybe when they eat, at times when they should keep the piercings clean. They don't do that well. Many people don't. Some do very well. Good job.
Okay, that's sort of some things you can avoid dental problems with
That's
your
right.
piercings.
Well, these piercings also, George, you think about this, if we take intraoral x-rays, they can interfere with the x-ray. So again, I'm not against these things, but you need to be cautious. Keep your mouth clean, keep your tongue clean, keep your tongue and your teeth and your gums brushed. And so keep everything clean as you can and take these things out before you come to the dental office.
Okay, very good. Very interesting. Anything?
Yeah, just keep smiling, sharing, and caring, my friend.
Thank you very much, Russ.
Thank you.
That's our report.